May kumpirmado ng kaso ng 2019 novel coronavirus o nCoV sa bansa.
It's been a year since the virus started. Almost a year since we quarantined. It's been so long that we have gotten to the point where even normal has become new. And this raises a question. Here in the Philippines, it's hard to not ask.
But how responsive was our COVID response? We have undergone what one would call a recession, the downfall of the economy, the increase of unemployment rate in the country, and the failure of our health security systems. While we have seen several actions and strategies formulated by the government with the help and cooperation of those in the health sector, we can't help but question, are all these efforts enough? Controversies, criticisms, failure of the protocol implementation, quarantine violations, inefficiency, ineffectiveness, and most of all, failure. Surely, we aren't ready for a second wave. That's why we need to start reassessing and reevaluating ourselves, our country, and our situation. This campaign started with my congregation, the Evergreens, and I, Yshia Rentegrado, with the aim to help and strengthen our COVID response in our country, the Philippines. First up, mass testing. We need to clarify that with mass testing, we don't necessarily mean that we are planning to test every single citizen of our country. Rather, what we mean by this is we need to extend and intensify our capabilities and abilities of testing. Why? We find that mass testing is particularly important or significant because of these three things. First is that it helps find those people who are carriers or asymptomatic carriers of the disease so that they should be isolated. Next is that it gives the government or those in charge of the COVID response a grasp of our situation in our country. And third is that it gives more epidemiological data that should be modeled for our course in this pandemic. We also need to realize that this mass testing also needs prioritization in specific groups or subgroups of people. So, first, we need to prioritize the health workers or those people who are most exposed to the COVID virus. Next are those people who are most susceptible to the virus, like children or elderly people, or those with respiratory or other diseases. And third are those areas with the highest risk of getting the virus. Next is prioritizing the pandemic as a health problem, not a political problem. While we concede to the fact that the pandemic is not the only matter that should be addressed in a state, we also believe that we are not prioritizing it enough as a health ordeal. Rather than strengthening our COVID response, we have been prioritizing other stuff that should have been more helpful if we had just funded more or given more funds to our health sector. What we meant by the prioritization of this pandemic as a health ordeal is, first, funding or more funding for those epidemic wards or epidemic hospitals, since these are people who carry or who take care of these people infected. Two, improving our health security systems. And lastly, the whole thing of funding different projects or bills that are pretty much useless during these times of pandemic. We need to realize that these political decisions are felt in everyone in our country. That's why we need to strategize and become more wise in planning our COVID pandemic response. In connection with what I've said earlier, it's not entirely impossible to flatten the curve or fight back against this COVID-19 pandemic that we are experiencing here in the Philippines. However, that is only possible if we follow what I've said earlier in those two things that I've mentioned, as well as what I'm going to mention next. If we reform and improve our healthcare services in our country as well as our health security system, then it is not entirely possible. Ay, wrong. What? If we improve our healthcare services and our healthcare security system in our country, then flattening the curve is not a far-off dream. There are three things we must consider to achieve this goal. First is to solve the very rampant graft and corruption in our government and our country which we are facing right now, especially in the midst of a pandemic. Second, is that we need to invest more on our healthcare services just in case that there is a second wave of COVID or other diseases or other things that we might encounter in the future. This is not only for the short term but also for the longer term. And third is to follow the paradigms of other countries which have survived and which have successfully combated their COVID pandemic problem. One example of this is Cambodia, as I've said earlier. If we follow through these 3 steps and probably add more, then we can possibly flatten the curve right now and secure our future. Next is choosing the better vaccine, or the more affordable but more efficient vaccine. Next is the ineffectiveness of pushing criminal liability to people who violate or deviate from pandemic rules. While many may argue that enforcing peace and order through criminal liability is highly effective in putting people in line, we believe that that's not the case, especially in times of pandemic. All persons are equal under the law, or at least that should have been the case. However, is this still applicable if the law especially favors those who are privileged? Let's take these 2 cases for example. Tatay Elmer and the Piston 6. Their only violation is disobedience, something as simple as that. However, they spent 1 week on detention center and had to bail themselves out. Tatay Elmer particularly had to pay 10,000 pesos, while the Piston 6 had to pay 18,000 pesos. However, these people below were not reprimanded at all. My point is, pushing this criminal liability to the citizens of our country is highly ineffective in keeping peace and order. And it just goes to show how easily exploited our justice system is. There are better ways to keep the peace and order during this pandemic. Lastly, we can strengthen our preventive and safety measures without forsaking our economy. While it is not new to learn how our economy in the Philippines has significantly fallen ever since the pandemic, according to the new statistics of the Philippine Statistic Authority, or PSA, as of January 28, our GDP, or Gross Domestic Product, has fallen to 9.5%. This means that our falling economy is falling even worse. That's why we need to rebuild it. There are 4 suggestions that we have regarding this problem. First is to build economic confidence. There's been a bit of falling out of the consumers and the producers ever since the pandemic started. We need to rebuild that confidence. Extensive and stronger testing and tracing, as what I've said earlier in the first part of this video. With this, we can strengthen our pandemic response and even determine the next step or strategy that we should be doing. And lastly, is to focus on the sector which suffered the unemployment most. Because of this pandemic, the falling of economy, there are a lot of people who suffered unemployment. That's why we need to rebuild that. We are urging the government, the people, to help us in this campaign of us.